Hello everyone, welcome to my channel Talk with Sana, and I am so pleased to bring you another series on neurodiversity. We are calling it Embracing Neurodiversity. And today I have with me Nayela Ahmad. She's a doctor, and Nazhah Khawaja, an author. And both of them, they're experts in the field. They are both activists in the field. And today they are going to shed more light on early interventions in neurodiverse kids. And we'll talk more about the myths which are present in our society, especially in Southeast Asia, what's happening in our part of the world, what we get to hear, and how the kids, they are not able to get the early intervention that's needed at the right time, and they're delayed, and then it just affects all their cycle. Everything gets delayed. So welcome, Nayela. Welcome, Nazhah. Thank you for being part of this new series. And please introduce yourself and let us know more about what is neurodiversity.
Thank you so very much, Sana, for creating this platform for such a very significant cause. So, Nazhah, please.
Oh, I can go ahead.
Let's know
Thank you,
first.
Sana. Thank you, Sana. Thank you, Nayela. I'm very excited to be starting the series with you two beautiful ladies. I think the more we talk about anything that is of significance, the more awareness we can bring. The more awareness we bring, the more change we can bring to our societies. So that is the purpose, and hopefully it is fulfilled. So my name is Nazhah, and I am an author. Yes, I work in the behavioral health industry. I was a behavioral tech working with children with autism in the homes. I've worked with in the special ed classrooms in Chicago public schools before, and I have experience working with on a personal level and also, in the professional field. I have cousins with autism, and it was always something that troubled me to see the effect that the families had. So what the families were facing in their communities when it came to bringing their child out into the public, and it's something that it was always I always wanted to discuss. So I'm very excited to be part of this panel, and thank you so much for having me.
Let's talk more about what is neurodiversity. Like, this is a new word we are hearing recently, and what all comes under neurodiversity. Which kids we can say that, or which conditions we can say that they come under neurodiverse or neurodiversity.
I would let Nayela start with that. And also, Nayela is with Listening Ears, and I'd love to hear about your work with Listening Ears, Nayela.
Yeah, so basically I'm a dentist, but now I'm a special educator and language interventionist with Listening Ears, taking care of children with hearing loss and neurodiverse kids too. So if we talk about neurodiversity, it's, as the name suggests, it's a kind of like diversity in the brain, diversity of neurons. Neurons are the nerve cells, the cells in our brain. So it's a condition. It's a condition with differently wired neurons. Like our brains are made, we have our skin color, we have our bone structure and all that. So it's a differently wired brain. The synapses, the connections, they are a little different. So that is basically, in a very simple language, this is neurodiversity. It's a condition, it's a state of brain, mind, and that is the biggest thing to know, is that is an innate thing, which is from the
and it's not a disability, right?
It's not a disability, but it's a condition which has some needs, and which needs some accommodation, some modification, some therapeutic intervention. Even if we say it's not just like that, okay, it's not a disability, so we don't need to cater for it. It's not like that. It's a condition which is different, which needs some different intervention.
Yeah, and we need to create an environment for those people to live a normal life like we live, So to make it normal, to make
it. And I think with neurodiversity, I think just knowing that when you're talking about neurodiversity, and the reason why we use that term now is because we're normalizing that, we're all different, and the brain functions differently, and it doesn't mean that and it could be and this trickles down to the social skills, or language skills and speaking skills. So looking at all of these differences in children, and knowing that it's okay, it shouldn't be seen as a deficit. I think that's the point of the term.
And as you mentioned about the social skills, so society is like a mutual thing. So it's not only about the child, like who's having some deficits in social skills or language skills. It's like we need to build up that environment, that conducive environment to foster those skills, because the society is a mutual thing. So we need, if the child is deficient, we can make a go ahead kind of a thing. So we need to build up that society so that people, and it's, this conversation which we are addressing, it's not only for the caregivers or the parents of kids who are neurodiverse or who are having some needs or who need something more than which we offer, but it's about the generic population. We need to create a better world. If we talk about inclusion, then inclusion is again a mutual process, in which we all need to take a step ahead. It's not only about the child or the family. It's about the other part of the world. As Nazhah's book is there, the other side of the life. So it's the other side of the life or the other side of the world which needs to take a step ahead, because they are more efficient. If we have the capability, if we are more socially active, or if we are more socially proficient, we can move 2 steps. If a child is moving just a half a step, we can move 3 steps ahead. So it's that thing which needs to be created.
Yes, exactly. The point is to reduce the stigma, right? Like the point is to reduce the stigma that's associated with neurodiverse children and also neurodiverse individuals just in general.
Yeah.
And their families too.
And let's talk about some of the myths that we hear, for the neurodiverse children. Like in the beginning, when parents, they see that the behavior of the child is not normal, it's different. And a lot of times they ignore their inner instinct, that something inside them is telling them that you need intervention, you need consultation, but there's something in their mind which is also telling them not to do, like it's something bad and it's not happening to you. So they're like, they want to hear what they want to hear. And then one of the myths is like, he will grow out of it. It's just a phase and all the kids, they do it at this. And somebody has a language delay, somebody spoke at 7 years, somebody spoke at 8 years. So what do you think about such myths, and what can parents do actually, like for the early intervention in such cases?
So as you know, as Sana, you very rightly mentioned, it's not only about the diagnosis part, it comes before diagnosis. When we are seeing our kids growing up, and when we, sometimes our family members, or if someone is noticing, even the neighbor, or even we are also noticing something, we just don't pay heed to it, or we don't want to pay heed to it. Like we say, that if the picture, just close your eyes, and the things will change, the scene will change. It's not going to happen like that. If there is something, it needs to be intervened. It's like if someone is having fever and it's a constant fever and you're taking paracetamol and it's not going. So we need to get the tests done, blood tests done. And now, like earlier, sometimes what happens, especially in our South Asian communities and all, we have elderlies who say, okay, if this happened with that person and then they outgrew and all that happened. But sometimes they never outgrew, and it was always there all their life, and they were just labeled as, okay, he's dumb, he is this, he is that. And they grew all their life like that only. But now with medical advancement, like it's not that, sometimes people say that neurodiversity has grown. It has there's an inflation, but it's not only about the neurodiversity, this condition which has grown. It's about awareness. It's about the diagnostic measures, the medical advancements, the therapeutic interventions which are present. And I would just say that only, as you mentioned, that follow your guts, follow your instincts, follow your heart. If you see that the child is, if you see there is a delay, a slight delay also, there is no harm in taking experts' advice. There is no harm at all. Just go to them, speak to them, get the tests done. There are facilities available now. There are many facilities. Go to the psychologists, go to the neurologists. As we're talking about neurodiversity, so go to the neurologists, go to the child development specialists are there, pediatric development specialists are there. child psychologists are there. So these are the initial steps which should be taken if you see a slight delay. And now the research is that the signs of neurodiversity could be seen since infancy. So it's not that the child has to grow till 2 years and then you can diagnose it. That is a different thing, that you'll get an official or formal diagnosis at 2 years. But before that, the signs could be seen and the intervention could begin from the very beginning.
Yeah, that's the thing, right? You know, as a mother, you have that gut feeling. So I would say, as mothers, react on your instincts, you know, for your child. If you feel there is something and you need to get tested, you should do it, you know. Don't listen to all the things that somebody grew teeth at 10 or somebody started speaking at 10. Just follow your instinct and, you know, get tested. And there's another myth, like people in India or Pakistan or, you know, all over Asian side, they want to try everything. Like, we are believers, which is very good thing. But sometimes it's affecting in the way how we react or what's the intervention needed at that time. Okay, you're looking for a spiritual or a godly intervention and you're going to the spiritual places or the gurus and, you know, like to get the blessings, but that's okay. But you're delaying the therapy that your child needs. It needs a blessing, definitely, but it also needs the therapy at that moment. And then the parents, I see that they're trying everything except therapy, you know, like your child needs something, you're not giving him that thing. You're giving him things that he don't need. So Nazhah, what do you think about it?
I would say yes. And you know, just for the viewers, I work in early autism services. We are a behavioral intervention therapy provider. And what I've seen in my work, working as a BT, is because this was a hard thing for me to understand, is like, you're willing to try the new diet. You're willing to try, you know, speaking to a spiritual leader. Which is fine. Everyone has their customs and beliefs, and you're willing to, you know, change the schedule around or do all these. But why aren't you willing to consider the therapy that's required? And I really think it has to do with stigma and what people would say. Because when I was in the homes, you know, families would tell us sometimes, like, please don't tell the grandma who you guys are. We're telling the grandma that, you know, you're going to play with the child, you know, you're some sort of like babysitter, nanny or something like that. And of course we want to respect the family, and we want to respect the requests of the family, and so we comply. But it's always in my case, you know, it was always if there was an elderly, you know, like the grandma or the grandfather or the older aunts and uncles, they didn't care so much if it was someone, you know, one of their friends or someone their age. And so it just, I think for me, what I concluded from that was that it's that stigma of a child needing therapy means that they're lacking so much in an area that they're unable to function properly in a society or at the normal level. But who decides what the normal level is, right? And I think like, you know, it's okay to want to try the new diet, and it's okay, but you have to normalize trying out the therapy too. And I know, you know, and this is a topic that is close to home because my son needed therapies as he was born premature, and it was hard to answer questions sometimes. I had a few supportive friends, but some people are just like, well, why? What can't he do? And what did you do wrong? So it's like, then, you know, on top of knowing that my child needs the help, I'm having mom guilt because I'm like, what did I do? Did I not pay attention to this? And did I not notice this? And so I think trying everything but therapy shows me that, you know, tells me that we are still as a society failing in just making it normal and making it okay for a child to need additional help and support. And sometimes as a mom, you don't know, and it's okay. You're not supposed to. We're not given a manual on how to be, you know, what to look for. And so taking them to the experts is okay. Just as Nayela said, you know, if they're needing, you know, if the fever is persistent, you're going to take them for additional testing. In the same way, if you see that some of these things are not being, some of the behaviors or some of the you know, what it is that the child needs help with is not being addressed, and he needs additional support, take him to the expert. And we are in a good time and age now to be able to find these people. They're very accessible now, I think, more so than in the past. And it makes it easier than it would have, you know, 20 years ago. So you should take advantage of that and get a consultation. And sometimes you know, just because you get the consultation doesn't mean you are obliged to anything. But getting a free consultation or speaking to an expert is going to provide you with just a bigger perspective.
Yeah, and to just add on to a little, like as you mentioned about therapy, the term therapy, yeah, there is a stigma attached to it, and we really need to. And this is one of this cause and the reason we are having this conversation, that these terms, these vocabularies needs to be normalized. That it's okay, it's therapy. Therapy is not something like you know, you are getting like even if it's related to drug addiction and things, also the rehabilitation parts, the needs, that it's just the need of a child or a need of an adult or a person, and it's the need which needs to be catered for. We just need to understand that and normalize this. And then, as you mentioned about the mom's guilt, yeah, definitely this blame game, and this is very much prevalent in our part of the world. And it's like, oh, mom, like if something good happens, then mom is the goddess, and if something bad happens, then mom is like. So,
no, if something good happens, mom is not the goddess. And everyone else comes first. You know?
That's also true. Very right. That's also true.
Yeah,
and then
everyone else, society, environment, teachers, grandparents, everyone will come first, and then the mom. But something bad happens, it's entirely the mother's
mother's fault, correct. And then, you know, when a child gets a diagnosis, then emotional impact, there is an emotional impact, and those emotions are for real, and those emotions need to be catered for. That's why we need to build that conducive environment in our society, because then it's not only about the child or the diagnosis part, but it's about the moms or the parents or the caregivers' emotional health too, because they had their own dreams being shattered. And then there is like a big research and things on that, and hopefully we'll like in our next sessions, coming up sessions, we'll discuss those things also. But these emotions needs to be catered for, and we need to sensitize the world around for the same.
I have another myth where people say that, you know, like once you have a child which is diagnosed, like they waited for long and then they finally think that, you know, they should get a diagnosis, or somebody pointed to them in the school the different behavior and then told them to get diagnosed. Then the blame game started, as you say. And the first one is the screen time. You know, is the screen time is the problem. Because of the screen time, all these things are happening, all these problems are happening, you know. But I've also seen kids who are on the screen for so long, and then, you know, they're like, I have my niece, the parrot, and then, you know, she's almost on the screen, and everything she's learning is from the screen, you know. So I can't really blame the screen. I mean, all the ABC my son has learned is from the screen. All the numbers he learned from the screen. So it's not really that bad, you know, like they need a screen time, which helps them to recreate or to learn something. We can limit that screen time, but we cannot make an evil out of screen time, you know?
Yeah, so Sana, like as you mentioned, and as I mentioned in the very beginning, that neurodiversity is something which is innate, and there is research that it is that it is genetic. It can be from parents, from grandparents, from aunt, from uncles. It's genetic and it's innate. It's inside you. The extrinsic factors like the environment, the interaction, the screen time, the diet, they may elevate or aggravate the thing, but it's never the causative factor. We need to understand that. Many of the parents come to our center also, and they are like, okay, my child is not speaking, there is a language delay, there is a communication delay. And you know what, and especially after this, like the pandemic hit, because I think because he's all the time on the screen or mobile, that's why it's happening. And I mean, they are only giving the diagnosis, they are giving the results of the diagnosis, you know, the treatment part also, and everything. And because the society around is like that, but we need to understand that screen time may aggravate things, but it's not the causative agent. It's never the causative agent. And we need to understand that also, that the world is being digitalized. We can't go back in Stone Age. we have to pace up with the world, and our kids will see screen. And in even, we have some devices, they're called like alternative augmentative communication devices. They are screen types only, they're like screen, they're device only, which are used for communication to help child who are like to help children who are especially they're non-verbal. They use it as an aid to communicate their needs and wants. So we need to understand how the screen should be used for maximum benefits, but just blaming that, okay, because the child is watching mobile, and it's absolute myth. Screen time or a specific diet, a balanced diet always helps a child, or sometimes if a child is intolerant to some diet, then obviously it needs medical intervention. But we can't just put a blame on screen time or diet or these extrinsic factors. It is something which is innate, and it needs to be like intervened for from the root cause. Like the roots needs to be, not, I won't say treated, but
I think the first thing to remember is that the innate condition is genetic. So anything which is happening around can aggravate or make it less, but it's a, genetic and a inborn condition. So that's I think the 2 points that people can remember before, coming on the self-diagnosis and the self-conclusions.
Yeah. And then I think like the blaming thing too has something to do with I know we're talking about, our South Asian communities and in our community. I think the blame, the topic of blame is like a big topic itself amongst our community. And I feel like we're always trying to, like, it's because of this, or it's because of her, it's because of my father-in-law, and that's not going to help. I mean, and then
like he was putting him in front of TV all the time. She was just sitting next to her all the time with the TV. So it happened because of her.
And it's endless, right? You can blame this person, and you can blame that person, and you can blame the screen, and then you can blame your phone, and then but the issue is you're not going to solve a problem if you're stuck in the blame circle. So I would say, just to get out of it and divert your attention to something productive that you can do for your child instead of finding something to blame.
Yeah, we need to get out of the, those cobwebs of blames. There is no point in getting tangled in that.
Yes.
Like there is another thing that I saw in the families or, like around in TV or whatever, is when there is a child diagnosed and then there are neighbors or friends or, people around that feel that it's a contagious disease and they want to keep away their children or themselves, and they just shut down that family completely, So people are very insecure to even accept it because of the stigma or taboo associated with it, that, like you will be, I would say, like the child has to go to a special school, he cannot or she cannot go to a normal school, and, he or she cannot have normal friends. And then the people, they are more, I would say, how do you say, superstitious and, not really open in their minds, and they think it's something contagious, and, their child can get contaminated, they can get contaminated with it. So what do you think about these points?
This is the saddest part, in my opinion. It's just like the saddest part of any individual that's neurodiverse, because it just further isolates them as an individual. So not only is it already difficult for them to communicate and learn and behave in a society where everyone is kind of like, this is not what you're supposed to do, not only is it difficult for them to navigate their own self in a society, but also that feeling of isolation, because even though sometimes these children are unable to express, they are absorbing all of that from other people.
The energies,
the energies, and it's a disgrace. I think as a community, I think we should really rethink the way that we operate sometimes. This is very much ignorance. I would say it's ignorance. It's not anything else. And the only way to address ignorance is to just educate ourselves and do the research. There are of course there are diseases and conditions that out there that are contagious and need to be we have to be careful about. But neurodiversity is not, does not fall under that category. And then we are further preventing families from trying to seek out that help, because the families don't want the neighbor to know, because the neighbor will not let the child play with their child, or we can't tell this person because this person thinks that they're. And I've seen this firsthand where a child with autism is put in a room with a TV or something because there are other people coming into the home and we don't want to make them uncomfortable. So let's put the child in the room. And it's bizarre. It's completely bizarre.
Some people, they will lock up the person and they want to hide that person from the world.
It's insane.
You're
it's
further
inhumane.
alienating and isolating that person,
It's inhumane in my opinion. And I think what needs to be done is having just even one sentence like, hey, this is what's going on. This person operates a little bit differently, and this is what's going to make them feel comfortable. And I remember, my friends would ask me before we had a play date, would your son be okay with this? Because they knew that he had some sensitivities of sensory overload he would get, and so they would say, would this activity be okay for your son? And it was just very thoughtful and considerate. And I think we should really rethink the way that we operate, honestly, as human beings, and just be more accommodating to people with differences. And even as adults, if we take ourselves seriously enough to say, hey, I'm an introvert and this party or this gathering is not going to work for me, we should really use that same sort of attitude towards children and other people as well.
Yeah.
And yes, and it's like when we are saying we are secluding our kids, the typical growing kids from neurodiverse kids, what we are teaching them and what kind of values we are inculcating in those typical growing kids. So, we talk about inclusion, we talk about, be kind, courteous. So we need to practice those things when we are practicing. And then there are different measures, which could be when we are talking about social skills of neurodiverse kids, then obviously we need the society to be with us. We need those friend circle, we need that support. And there are like support system, there are professionals. Now, then also comes the role of professionals who can teach the parents, the caregivers, who can build the confidence in them that, okay, these are the measures. They can help them up with the, with the write-ups or with the flyers or even with books or pictures or something which can guide not only the parents or caregivers how to build on the social skills, but also the friend circle and relatives and grandparents to sensitize them. There are sensitization measures which could be taken up in society. And first thing is definitely acceptance, but there are measures. And acceptance is not like a sorcerer's stone that, okay, you get it and then it's done. Then definitely it's a journey, and the destination remains the same. Even if you're having a neurotypical child or a neurodiverse child, the journey is little different, but ultimately it all ends up to a single destination for everyone, it's like everyone's well-being.
Yeah. And I would like to add, and just not to take up too much time, but I just wanted to add, these differences that we think are going to affect children's interaction is something that we create in our imagination, honestly, because children are so loving and accepting. And even if they do see something different, they don't judge it. Just like sometimes adults are quick to judge, but children do not do that. And I remember one of the children that I work with, it was outside of work time, and I was planning a museum date, a play date for that child that I worked with on the spectrum and my kids. And all I did was to preface the interaction was, this child, he is sensitive, and we have to make sure that he's okay, and we just have to keep an eye on him, and he just functions differently, and that's okay. And that was all it took to tell my children, and for them to know that it might be a little bit of a different type of interaction, but that it's okay, that and taking out that judgment factor, I think is very important. And it was a successful play date, and everyone had fun. And so a lot of times I think the adults are the ones who construct this in their minds, but it doesn't exist.
All right. And then we should always remember that it's like we all are human beings and we all seek connections. And it works the very same even for neurodiverse. Though they may seem that they are not socially capable enough, but they also seek connection. They also seek relationships. They seek that somewhere inside, and we should give them. It's their prerogative and should be given to them.
Yeah. Thank you, Nayela, and thank you, Nazhah, for your insight and for breaking these myths and sharing, so much information. And I would say, like we always say, it takes a village to raise a child, and neurodiverse children need the full society. The parents need our help, the children need our help, and we as an individual, if we are, connected as a parent or as an uncle or aunt to these children or not, it's our responsibility to support or become, to provide that kind of environment for these children. Like the research is ongoing, how we can help these people, how we can support these people, and it will go better and better, how we can make that environment so that they function more efficiently. But what right now is like our support to the parents and the children, our openness, and that support and acceptance. And sometimes, I mean, in the next session, maybe we can talk more about what all includes in neurodiversity and what all as a individual we can give to support the parents of neurodiverse children. So thank you so much. It was a great session, and I hope you would have taken something with it, and we will come back with the next session next month, and stay tuned. Take care.
Thank you for having us, Sana.
Bye.